Welcome back. Let's take you here now. Active cases of COVID-19 in South Africa continue to rise after the country recorded over 4,000 new infections for a third day. 4,230 new cases were reported in the last 24-hour cycle. The positivity rate stands at 16.8%, down from 17.7% in the previous reporting period. Active cases have increased to over 26,000. 12 new COVID-19 related deaths have been reported, taking the death toll to 100,298. For more on COVID-19 numbers, SABC spoke to Deputy Vice-Chancellor of Research and Innovation at the University of Kwazulu-Natal, Professor Mosa Moshabela.
At the end of March, there was a report from the MRC that the wastewater surveillance was picking up COVID-19. So we knew then that we are going to start to see cases rise because usually that form of surveillance is sort of a leading detector of cases that might begin to increase. So since then, this week we've really seen a rapid doubling of cases. Doubling of positivity rate. We've seen also now cases that are becoming a little bit more severe, being admitted in hospital in the last day or so. Hospitalization is also beginning to spike. This to us makes it clear that we are, now seeing a new sort of wave of infections of COVID-19. And it's not really something that is a blip as it might have happened, in the past few months. This one looks like it's actually a clear trend. The variant that we are seeing at the moment is still Omicron. But I think what is significant is that there are subvariants of Omicron that we are seeing, almost like branches that have emerged out of Omicron. So at the time in November, December, we saw BA1 and 2, and now we are seeing BA4 and 5. These are part of subtypes of Omicron. And, at the moment, what we know is that they are infectious. We also know that they carry one mutation that emerged out of Delta. And it looks like they may be able to escape immunity. And we are basing this on the fact that we are seeing a little bit more reinfections in cases. So, the balance of these variants that we are seeing is the one that's driving the cases that we currently have on the backdrop of the fact that even population immunity may have declined a little bit in terms of antibodies ever since the last wave, the fourth wave. But I can say that we don't know yet whether we are going to have a new variant. Based on the previous trends, every wave had a different variant. So it's very likely that we may be seeing a seeding of a new variant. But so far, I think the consensus is that we may be only seeing BA4 and 5 currently, and then we'll continue to do genomic surveillance to see if there are any other changes.